And one of the most important testing expansions we have launched is to require universal testing of residents and staff at all skilled nursing facilities in San Francisco, including, of course, the largest skilled nursing facility in the region and one of the largest, if not the largest in the nation, Laguna Honda Hospital. I'd like to provide a progress report on how our universal testing is going at Laguna Honda Hospital, and we'll have final results next week on this. But we were, as we initiated the universal testing order, Laguna Honda was the first skilled nursing facility in the city to begin universal testing, and that started on May 4th. Resident testing, so the people who live in the facility, the residents, resident testing is now complete, and staff testing will conclude next week. So far, we have of the approximately 2,500 staff and residents of Laguna Honda, we have completed screening, the universal testing of 2,087 people. So just in this facility alone, over 2,000 people have been tested, screened, if you will, tested on a routine basis because they either live or work there. This testing allows the hospital to proactively protect residents and staff from exposure by identifying COVID-19 cases among people without symptoms. And we know that many people have COVID-19. They may not show symptoms, or whether it's because they don't show symptoms at all during the course of the infection, or whether they're in the early stages of COVID-19 disease. As of yesterday, 718 residents and 1,369 staff have completed the universal testing, and we've had just 4 positive results, 2 among staff and 2 among residents, as again, a result of this universal testing. That is a less than 1% positivity rate for, in fact, I'll be very specific. I know I'm throwing out a lot of numbers around today, but it's a 0.19% rate. That said, with increased testing at Laguna Honda, we do anticipate additional COVID-19 cases. We know these institutions are highly vulnerable to infection with COVID-19, and while we are being extremely vigilant, we know that it is likely that there will be more cases. The key thing is that we do as much as we can to prevent cases, to detect COVID-19 cases when they are in the facility, either among staff or among residents, and then take aggressive action to limit the outbreak, and of course, care for both the staff and residents who are found to be infected. The people who have followed up, who have tested positive, we have followed up with contact tracing and so far have tested additional residents and staff based on the possible exposure from these 4 cases. This past weekend, that follow-up enabled us to identify a small outbreak in the South 2 neighborhood. These neighborhoods are historically been, you may think of them as hospital wards. It's a neighborhood because these are long-term residents, and certainly goes beyond sort of the traditional hospital ward, but it's an area of the hospital where residents live together and where staff work together. So we did identify a small outbreak on South 2 precisely because we implemented this universal testing, this universal screening process. We had found 2 cases there through the universal testing in that neighborhood, and case investigation led us to test additional contacts as a result of that. This additional testing resulted in 4 positive cases in residents who had previously tested negative. So again, because of our vigilance and repeated testing, we were able to identify 4 positive cases of residents who had tested negative before. This is an example of the systems that we have put into place working in the way that they should and in the way that they must, enabling us to take action quickly and to move quickly in response to testing results. Staff who test positive are immediately sent home to self-isolate and provided with supports, and residents who test positive are immediately transferred to the new dedicated COVID-19 unit at Laguna Honda, where all best practices and best medical care is provided. All staff and residents who have tested positive, I'm thankful to say, are in good condition, and we have quarantined South 2 and continue to monitor, test, and investigate contacts. So these new cases bring the total confirmed COVID-19 cases to Laguna Honda to a total of 29. Again, that's going all the way back to March 22nd, 11 residents and 18 staff. Several of these cases have fully recovered, and I'm thankful to say that the rest remain in good condition. I'm also thankful that to date there have been no deaths from COVID-19 at Laguna Honda Hospital. And I'm really just so personally grateful to the residents and the staff at Laguna Honda who have worked tirelessly to continue to contain the spread of COVID-19. This universal testing, which will now become routine at Laguna Honda, a huge lift, something that took really a great amount of investment and time, and I'm just so grateful to the leadership at Laguna Honda and the staff there, who are not only doing the work that they did so well before this pandemic, but now being resilient, being flexible, being nimble, and ensuring that they're continuing to take the best care for residents possible. I am proud of our work. And really want to thank the ongoing collaboration with the CDC, the Centers for Disease Control and Prevention, and the California Department of Public Health. The improvements that we've made at Laguna Honda not only benefit the more than 700 residents at Laguna Honda and the workforce there, but we are also sharing what we learned with other skilled nursing facilities across the city. In San Francisco, approximately 40% of all skilled nursing facility patients and residents have been tested through universal testing to date. 5 facilities have completed universal testing, 4 are underway with our support, and the remainder are planned in the next coming weeks. So in conclusion, over the next weeks and months, we will continue to focus on vulnerable populations and expand universal testing to more congregate settings, including shelters. We will continue to focus on the 5 indicators that I and the mayor have emphasized. We will continue to work together with community, businesses, and other stakeholders across the region and coordinate with the state to accomplish as much restoration of activity as we can. And we know that the coronavirus is still here, but we are going to find a way to protect each other and enter a new era for our city, for San Francisco, for our community. We continue to rise to this occasion. And San Francisco, I can't thank you enough for your dedication to the entire health of the entire community, and I look forward to moving forward together. Thank you.